I'm Paul Cook, GP at Carn and Down Surgery. Through the last sort of, I suppose 15 years, gradual frustration was developing in terms of services changing, problems I was having with getting things sorted with patients, and I got more involved, and I was basically told, you either do something about it or you be quiet. Gradually the opportunities arose, particularly through mental health, to do more things about it, and I've been doing that for some years through the PCT and now CCG. The opportunity arose nearly 2 years ago now, and I applied and surprisingly have got more and more involved, and it's been very interesting to see how that's dovetailed with the work I was already doing, and has facilitated that. But it's also opened eyes to a lot more of what's going on between organisations in the broader NHS, and what influence we can have. I've been surprised at the respect and time that's afforded to clinicians in general in the CCG, and amazed at the influence that GPs, my colleagues, have had in situations, and I think through feedback I've realised I've had the same as well, which has been really good to see, because you can feel that I think the worry is that you could be tokenistic, you're just a clinician that's been brought in to rubber stamp something, whereas there isn't that at all in the governing body. And whilst I've been there, I've been able to help support and work with the CCG as how to make the CCG develop systems that are more considerate of mental health service users and mental health sort of systems. And as a result of that, the priorities for a lot of the work and any available money that comes down or any investment that we can put has been badged towards mental health, children's or primary care, which has been great. And I think there's a sense that what's the point and nothing changes, but I've seen a tangible change in what other people have done, and I've felt there's a definite shift from where I started in this work to where I am now, which is, looking back you kind of think, oh, that couldn't have happened, but it has, so it keeps me going. Basic things are governing body commitment is the first Tuesday of every month, and 2 out of 3 of those are the public meeting, so a public part 1 which takes most of the morning to lunchtime, and then a private part 2 session without the public in the afternoon. In the third month, when there's no public meeting, there's development sessions. We've done all sorts of things, ranging from media communication to strategy planning, and other developments and projects and things. So those essentially, if you give up first Tuesday of every month, then there's associated reading, planning work around that you're compensated for, which will take some hours. And then most of us are either involved in either 1 or 2 of the governing body committees which sit underneath, and that's finance, workforce, quality and performance, audit. Those are usually half-day sessions again, those committee meetings, and then again, depending on the meeting, but pretty much you need another session in terms of preparation time for the amount of volume of data to go through. That has always ticked my box anyway, because I like the data. I like trying to churn through and see where things are changing, what's going on, or why is that doing that, and we're really encouraged to have an inquisitive mind and to challenge systems, to challenge individuals, to challenge anything really that we see, so long as it's for the communal benefit really of health in Cornwall. We actively put aside our personal practice needs. We are aware of conflicts of interest that we make sure we talk about and are accounted for or avoided. But essentially we're trying to look to make better systems and better outcomes.